Morning.
If you didn't read your newsletter, then you probably don't know why I'm running the meeting. But Mike LaChance has his plate so full with the school and trying to coordinate life at Rittner for thousands of people. So he has asked that he be able to step down from president for this year. David Mueller is also running his business by himself and has asked to step down. So I stepped back in with the board's approval to be president again this year. David Robinette's going to fill the president-elect position, which he's been filling that role by finding us speakers and coordinating Zoom since this pandemic hit. So appreciate everything that he's doing. This does not necessarily mean he is president-elect. We'll visit that before the end of the year so that we can figure that out. But those are the roles that we're gonna take on. The board decided to keep Zoom meetings at least through the end of September. We're addressing this 1 month at a time. So we'll keep plugging along. Update, I heard from Ted Mackin's good friend Paulette, they've placed him on hospice. He's at the Cedars there off of Clarkson in Chesterfield. Nothing imminent, just slow decline. He's not eating, not drinking. He's ready to go home. So keep him in your thoughts and prayers. With that, why don't we open with the Pledge of Allegiance, and then we'll take care of other things. I pledge allegiance to the flag of the United States of America, to the republic stand, one nation, under God, indivisible, with liberty and justice for all. Before we introduce our guests today, does anybody else have anything good for the good of the club? I see our district governor, Tom, is with us. Nice newsletter this week, Tom. Thank you.
Thank you very much. It's good to be here. It's hard to get a bike ride in and be here at 7, but I got it done today.
All right.
I'm on 60 days consecutive riding, so I figure I'm going to try to ride the entire summer at least once a day. So
sounds
anyway,
good.
Keeps me sort of sane. So thank you, everybody. And I think Bill Strohmeyer, I think you share the birthday with my son Andrew, don't you? You're muted, Bill.
I've got everybody muted, so if you want to talk, you'll have to unmute yourself. Okay, Bill, go ahead.
Hi. Mine is the 18th.
Okay, all right. Yeah, I thought I might have had it. Oh, I think it's Brian Hercules' birthday today, I think. But he's late. That's pretty usual. So anyway, thank you, everybody. I'll let things go on.
I might share something with y'all.
Please do.
I want to share something with y'all. I've been involved at Central Methodist University for years as a trustee. We are going back to school and we're testing every student who's coming in. And out of 500 tests that we've done, we have 6 positive virus students coming back. So it's kind of an interesting statistic, but it's higher than they want. But still, 6 out of 500 is
not too bad.
Not too bad. So thought I'd share that with you.
Our church school has decided to go face to face, so they're launching, trying to fill the classrooms conservatively. So, there's Brian. Morning, Brian.
Good morning.
How are you?
Not too bad, thank you.
So Tom was thinking it might be your birthday, is that right? He's smiling.
Yeah, it might be.
Well, happy birthday. We will not dare sing over
Thank
this.
you. Thank you.
Oh, all right. So I'm going to turn it back over to Dave. Dave's got lined up our program, and I'll let you fill us in on what we're doing.
And I'm going to be very brief. I came across RX Outreach literally on my feed on Google. Had no idea they had a great write-up from one of the local stations. I forget who it was that even put it together. And it was on my Google feed on the phone. I thought, well, this is kind of interesting. Then I realized they're in Maryland Heights. Well, this is really interesting. Went on their website, and just there's a contact me part on the website, and I just sent an email out. And I thought, well, if I get a response, great. If we don't, hey, I tried. And Bill got back with me, and here they are. And to be honest, I don't know much about them. I did put it this way in the email: as one nonprofit to another, would you be willing to talk to us? I was up front and said it's 7 a.m. Normally, when we do this face-to-face, we get the lock-in first that you're going to come on a Wednesday, and then we tell you it's 7 in the morning. I didn't do that this time. I figured this is a little bit safer. So I'm going to let Bill and Carolyn take it, and you guys do, you explain it to us, and I'm going to shut up.
Sure. Well, first of all, thank you so much for inviting us and reaching out to us. We love that. You're probably talking about the KMOV piece that aired a couple of weeks ago. So we love that that actually reaches people and that caught your attention. So thank you. So my name's Carol Berkey, and I am the Director of Marketing and Development for RX Outreach. And I am with Bill Vatterat, who is the Marketing Manager at RX Outreach. So we're just going to kind of walk you through kind of the history of RX Outreach, how we kind of came to be, our core program, and what we've done in the fight of against COVID-19. And then we'll talk a little bit about our Serving Those Who Serve Others program that assists businesses and other organizations. And then we can open it up to any questions you guys might have. So I'm going to kick it off. So RX Outreach actually started as a program under Express Scripts, which I'm sure you're all familiar with Express Scripts. So our founder, Michael Holmes, who was an executive at Express Scripts at the time, he's a very spiritual man, and he was praying one night and just said, God, you know, there's got to be more to life than making money. And the next morning, he feels like he was divinely inspired to write what became the business plan to spin RX Outreach off as its own business. So in 2010, RX Outreach became its own 501c3. So we are a nonprofit mail order pharmacy. We are based in St. Louis, actually in Maryland Heights. We serve all 50 states and U.S. territories. And our mission basically is to help people afford or to have access to affordable medication. And kind of as a side note too, as a tribute to Michael's divine intervention, our inspiration, on top of every bottle cap that we send out is printed honoring God by serving others. So I'm going to hand it over to Bill. He's going to tell you about our core program and our fight against COVID-19.
Sure. Thanks, Carol, and good morning. And I echo Carol's sentiment to thank you for the invitation to join you all this morning. So, you know, RX Outreach, I like to say that the point of any nonprofit should be not to exist, right? Because the problem for why you exist has been solved. And, you know, medication costs continue to rise. And so more and more folks are in need of affordable medication. And I mean, I think of my mom who goes to get her prescription at Schnucks because she can make 2 right turns. All right. And it's convenient, and that's it. And it's a little bit of a guessing game each time she goes to the drive-through or goes up, what it's going to cost, whether a medication is going to be covered by insurance. I've tried to teach her about GoodRx, about how to find, you know, coupons and things like that. But it's really confusing. And I know even myself, One prescription my doctor had sent to Walgreens, and they said, "Oh, it's not covered. It'll be $70." And again, being familiar with the space, I said, "Okay, hold on a sec." And I stepped back, went into GoodRx, and found the same medication for $7 at a different pharmacy, which was exactly one stoplight away. $70, $7, the same medication. So it's really confusing, and that's part of the beauty of RX Outreach, is that we keep it simple. So we have over 1,000 medications on our formulary, primarily generic and primarily for chronic conditions. And so what you see is what you get in our pricing. The price includes the free shipping. It includes a pharmacy consultation. So there's no kind of coupons. There's, no promo codes, all that kind of stuff. So we like to keep it simple. So we know we initially started serving people that were 300% of the federal poverty level. And when we realized, we kept hearing from people that said that their medication price kept going up. We now have our income guidelines of 400%, which is a single person making under around $51,000 a year, a family of 4 making $105,000 a year. But because of COVID, we expanded those guidelines, because we know that people are, underemployed, they've lost benefits, and may be sick themselves or taken in a loved one. So now anyone who is affected by COVID financially can qualify for our program, and our details are kind of on the website. So a person simply gets a prescription, and as we receive it, and we can send it out. We don't take insurance. That's one of the things that keeps our kind of prices low. So, there's other free medication sources around. A person can try and find a patient assistance program or things like that. But the problem is that those sources run out, or they're very limited. There's not consistency. So we are, very consistent with the medications that we have, particularly if somebody has multiple medications. So it's not unusual for someone to be able to get a medication from us for $20 for 6 months of medications. People that do have insurance oftentimes come to us because it's actually cheaper to get the medications through us than with their copay. So we also, we've also found that, a lot of people have their favorite local pharmacy, and they need that pharmacy and that relationship for acute medications, for, different things that we may not carry. And so we know we're not kind of all things to all people, but we are able to help, and we save people, I think, around $100 million from retail costs every year. So I mentioned GoodRx earlier. We would love to be on GoodRx. Unfortunately, it costs too much money. When I started at RX Outreach 4.5 years ago, I was in, like any nonprofit, in the development or fundraising department. And I remember saying, we have hundreds of thousands of prescriptions every year that we send out to people all across the country. Why don't we just add $1 or 50 cents to it? And then we wouldn't have to do all this fundraising. And someone said, that doesn't work, but we really work hard. We have that corporate efficiency on our website. You can see the technology we got from Express Scripts. It's amazing, but we have that real, the charitable heart. We really are mission driven. So when COVID broke out, we realized that we were kind of uniquely positioned to help people stay safe. So they could get their medications from us. We could have it we deliver it to their home at no charge. So other pharmacies have kind of come onto that. This is how we were created, so we can help people stay safe, and kind of reduce the chances of folks kind of getting contracting it or having to go out. So our expanded guidelines also include, if you are taking care of a family member, if, someone is unable to work because of COVID or unemployed, anything like that, that we can accept them. So, so it's pretty easy. You go through our website to, open an account or to call our call center. We get, I think, around 8,000 phone calls a week at our call center, which again is in Maryland Heights. And I think that's it. We have refills through text messaging and such. So, some of the examples of medications, I mean, you can look, everything is listed on our website, for different disease states and things like that. We also add medications based on what people have asked for. So NeedyMeds.org, NeedyMeds is a great partner of ours. They're based in Massachusetts. And again, it's all about helping people find resources, medication. And we were giving a presentation there, and the Hepatitis B Foundation reached out. They're based in Pennsylvania, and said 20% of our phone calls in the first 3 months of the year have been about finding medications and the cost. Is there any way you can add any of these medications to your formulary? And so, we did our research, and sure enough, we added 2 of them. Well, what that does for not just for patients, folks with Hep B, but their families, the quality of life, the consistency. I mean, when we have our health, I mean, it's that such a blessing. And it people, I mean, Carol and I love the patient stories when we call out the patients, because, we ask, what would you do if you couldn't, get this medication? Like, well, my dog would have to fast 2 days a week. I mean, it's, things where people just really have to make tough choices. So, so that's a little bit about our program, the core program. And I think, Carol, were you going to speak a little bit about one of our newer programs, Serving Those Who Serve Others?
Yes. So thanks, Bill. So under the umbrella of RX Outreach, we have a program called Serving Those Who Serve Others. And basically, essentially, it's a pharmacy benefit program offered to businesses and organizations at no cost. And it allows their employees to have access to affordable medication. So the program covers the employee and their dependents. And the program follows the same income guidelines as our core program. But in addition to that, it gives employees an additional 5% off their medication. So the price that's listed when you go to our website, it's 5% off of that if you're a partner program with Serving Those Who Serve Others. So for the benefit to businesses, it allows them to, keep their insurance rates low while adding an additional benefit to their existing benefit packages. And, a lot of businesses that we've talked to about this program that are partners with us, they're not even able to give their employees an option of any benefits. It's so expensive for, as probably a lot of you know, to carry any kind of benefits these days. And so it's a way to give, your employees any benefit at all. And it doesn't matter if you already have an existing insurance program or if they're on any insurance. It has nothing to do with that. They can be insured or have no insurance and still be part of this pharmacy benefit program. And again, it's no cost to the employer. We just have the employer sign a agreement form that just says you're part of the program. And so we know then who is under that program. We can automatically enroll your employees, and so they don't have to do that part of it. They just start by sending their prescriptions to us. And so, it's part of what Bill was talking about. That's how we're, a lot of people say, well, how are you different than a regular pharmacy? And really, the main way that we are is that we focus on people over profits. So, our focus is on literally helping people have access to affordable medication. So whether that's through our core program, or if it's partnering with existing organizations or nonprofits to help the people that help them, that's what we do. That's our mission. That's what we're focused on doing. So that's, in a nutshell, the program for serving those serve others. And again, that's a program that's under the umbrella of RX Outreach. So that's basically who we are in a nutshell. And again, a little bit about our history, about our core program, how we've sort of pivoted in the face of COVID-19, and then a little bit about serving those serve others, a program under RX Outreach. So we're happy to open it up to any questions if anybody has any questions.
I do have everybody muted, so if you have a question, please unmute yourself or somehow let me know, and I will flip it back over that way. I know Todd just joined us. We do appreciate what you do. Service is not always recognized in business anymore, and that's something that I think is outstanding from your standpoint. Is the reach out. Everybody in our organization, in our club that you see here, and others that are not, either one way or the other, all given from a business standpoint. Sometimes they and maybe one or two other people are the only ones that know about it.
Right.
It's not that you give because you want everybody else to know. You give because you know it's the right thing to do. You feel moved by spiritual, whatever it might be. And that's
Right.
one of the core values of Rotary is to help others.
Right.
Any comments?
One of the questions that we get a lot is, how can you guys do this? And just to let you know, we buy about 85% of our medication. So we're not doing short dated medications. We're not doing, things that aren't, totally approved. Obviously this is a highly regulated industry. So, we report to, I think, 38 states every day, their board of pharmacies. We have kind of surprises. So we follow all those. So every once in a while, like if a need arises and we can get a donated product, like right now, we have some albuterol inhalers, and those are a couple, I think, about 4 months out from their expiration date, so they're good to be used, but we can offer them for $12. And because we know the demand is there for our generic kind of EpiPens, our costs, you can get 2 pens for $30. But with all the kids with school and, parents are saying, well, the schools, I'm gonna have kids at home, so I need to have more of the EpiPens. We have those, and those are not short dated or anything, but we try to respond to community needs. And so just those 2 items alone, that are things that people really, really need. So that's why we're so appreciative of you all being with us or asking us to be here, because Carol and I are the entire marketing. We're the ones doing the marketing for this. So you being able to kind of share this with, I have a neighbor that I know they use this. That really, really helps us out a lot.
Right. And, to quote our president, Daryl Munden, the truth is everybody knows somebody who needs to have access to affordable medication. I remember when I first started and he said that to me and I'm like, I don't think I do. And then literally the next day I talked to a, grade school friend of mine, and she was talking about how her mom was really struggling. Her mom was, elderly and was really struggling with the cost of medication. So it really, unfortunately, that is true. Even in the United States, people don't have access to affordable medication. So we just appreciate any opportunity like this to get the word out about our outreach. We, like most nonprofits, we don't usually pay for any advertising. So the stories that we get on the news or, that that get pushed out, or either somebody's volunteered, or we've been contacted, or we've, you know, have a connection to somebody that can help us kind of get the word out. So, and again, you know, to find out more about RX Outreach, or if you know somebody that needs to enroll, just go to rxoutreach.org, and we would appreciate anybody also to follow us on Facebook and Twitter and LinkedIn. So that's a way to kind of spread the word too. So any help in those directions. And then, of course, any donation. We are a nonprofit, so that helps as well. And all that can be found on rxoutreach.org. Go to support. So, and if somebody has a question after this, Bill and I are always available. Dave, I think you have our emails, and so
I
we
do.
are happy to, follow up about anything. So, thank you again.
Any other questions, comments?
Yeah, I have a question. How many people do you employ, and how big is your budget?
We have about 80 employees, and you know, our budget, it's kind of strange because it's around, I think, $16 million. But you know, it's real strange the way it works, because when we get some products donated, which again isn't that much, it's the value of it, retail value, so it kind of expands it a lot more. So, but it's I think we're about, is that about right, Carol? I think around 16.
Yeah, I think it's a little bit less than that. It's a little bit less than that, but yeah, to Bill's point, so if we have a company donate product to us on our book, it's kind of complicated, but on our books it has to show of what that retail price of that would be, but that's not what we sell it for. And so it's a little bit complicated of how, you know, we look like we're making tons of more money on the books than we actually are. But that's just how it's kind of, you know, regulated. And it's kind of funny too, because one of the biggest questions we get is, you know, what's the catch? And there's no catch. I know that's just the tainted world we live in, that we actually want to help people. And I think a part of it too is, I always say, if, you know, if there were 10 companies like ours, nobody would really think twice about it. But the truth is this is a very expensive business to start, regardless if it's a nonprofit or not. And so that was one of the benefits we had being connected at that time to Express Scripts. When we spun off from Express Scripts, essentially they donated the building that we're in, or the space that we're in, all the equipment that we currently have. We've been great stewards of this equipment, and it's over 10 years old. But essentially it came out to be about $7 million. So traditionally, I've been in a lot of nonprofits. Traditionally, nonprofits don't have that kind of upfront money to start a business like this. And so that is why you don't see a lot of them pop up across the United States. There are some states who regionally have similar operations to ours, but usually it's just a region. It's just regionally. We cover all the United States, all 50 states, and U.S. territories. So that's kind of how we're a little bit different too, but there's no catch.
Can I give one other example? We also have a program, and again, we're not really like, it's funny when people say like, who do you work for? And like, oh, I've never heard of you guys. And you know, we have a program. It's now called Healthy Reentry. It was originally Healthy Transition. And we want to help people get medication. And we found that that when people got out of prison, they didn't have any medication. They came out with 30 days of medication, and that wasn't enough time for them to get to a doctor, a clinic, have a continuity of care. And a lot of those folks then were not able to get medication, and it would cause, you know, public safety issues. They would violate if they're off kind of mental health meds and go back to prison and such. So we piloted a program here in St. Louis to give an additional 60 days of medication to people when they got out, 30 days. So, and it was all grant money. We found grant money, but soon it was so popular that it was expanded to the entire state of Missouri. So through this program from 2016 to 2019, over 8,000 people got over 40,000 prescriptions free of charge. It was all grant money. So, and over half the folks got mental health medication. So, that was something that nobody really, very few people know that we did. The parole officers know it, the families of offenders getting out knew, but it was one of those things that we really didn't, we've had research and professor from Mizzou go through and found that this really helped reduce the recidivism rate. To incarcerate one person is, $25,000 a year of taxpayer money. So by just giving this bridge medication to help them just in those days before they have a job and all that kind of stuff is really, it's just the right thing to do. I don't think we didn't make money off of this. This was just the right thing to do. And it actually now has kind of been relaunched and expanded to other states. I think it's starting again here in Missouri because they recognize it's something that's really important. So, that's just the kind of organization that we are. And I know Carol and I are really proud that, as a nonprofit, people can open up our books and see stuff and just see that, that in an industry that's not really known for being charitable and thinking about people over profits, that we are ones that do that.
I've got a question. Bill, you mentioned that people have to meet certain criteria and basically have to qualify to take advantage of your program. How do you, is there any way that you assess what their needs are, or that you make sure that they do qualify?
So we take people for on their word. Once a year, we go through and we have kind of an audit. And this is kind of the industry regulations that, we have an audit of what people, what if certain people qualify. Now it's based on income, so it's not assets. So, some folks can appeal if we say, based on your income, you don't qualify. And, oftentimes people will then come back and say, well, actually, here's this, and I had this, and I had this, and then they qualify. To be honest, right now, because of COVID, again, because we're a nonprofit and we have our bylaws and we have to follow those, we want to open doors to everyone, but we need to make sure that the integrity of our program stays. So on the top of our webpage, it has the COVID, and you can kind of click on that. And when somebody wants to come in that may not qualify for the income guidelines of our traditional program, but because of COVID, they can. We just ask them to pick one of the options, and if it's the option that is none of the above, then somebody calls them and just says, tell me your story, and we want to try and make it work. So we don't ask for tax data and things like that. We really try and keep it simple for everyone, because there's just it's very complicated with what people with patient assistance programs and such. So I hope that answers it.
Mitch, I'm going to turn it back over to you.
Thank you, Carol and Bill, for being with us this morning. Good to hear about a local company and what you're doing to help folks. So, anybody, I guess all questions have been answered. Good. All right. With that, we want to wish everybody a good day. Happy birthday again, Brian. Brian and I are tag teaming on a program next week, so we look forward to seeing all of you next week. And stay safe.
Y'all take care. Be good. Thank you both, Bill and Carol. Thank you.
All right, thanks, David.
Thank
Goodbye.
you.